Right. So first of all, when we talk about quackery, that is actually, you can say, a type of a health fraud, which promotes products and services which have generally a very, very questionable and sort of unproven scientific basis. And quackery is generally carried out by unqualified healthcare providers. So when we talk about nutritional crackery, it exists in all the different forms in Pakistan, especially with the advent of social media. And unfortunately, since social media is not really regulated, so nowadays anyone and everyone who has some sort of knowledge, which might be even Google based, he or she comes up with the nutritional advice, and irrespective of the fact that the person has got some qualifications, relevant academic qualifications related to nutrition or not. So nutritional quackery exists in the physical form, that is the on-site, as well as the online mod is also there. Especially, we have seen that during the last pandemic, that is COVID-19. So we heard a lot of claims regarding the role of nutrition, which is there in terms of prevention of coronavirus. So a lot of those claims were largely unscientific and not based on research or evidence. So we have, unfortunately, a lot of different forms of nutritional quackery that exists here in Pakistan. Even in a lot of hospitals or clinics, you would see a lot of people claiming to be dietitians who actually are not, because doing an online diploma, which may be of 3 to 4 months, does not make you a nutritionist or a dietitian. Nutrition is a science, and for you to practice as a dietitian or a nutritionist, you obviously have to be very, very well versed with the knowledge of the field of nutrition. And for that, you have to have a proper degree, you have to have a proper training in a hospital, and then obviously you can practice as a dietitian. In a country such as Pakistan, where unfortunately the profession of nutrition is largely unregulated, so nutritional quackery is extremely widespread. You will find quacks in the field of nutrition literally everywhere. So unfortunately, we don't have any national level data on that. And if you talk about the impact on the health of the community and the health of the population, that is absolutely huge. And in some cases, the impact is irreversible. And also, we have two different forms of consequences. So there is some misinformation and there is some disinformation as well. So when we talk about the term misinformation, that is basically the spread of inaccurate information related to food and nutrition. And when we talk about disinformation, so that actually involves deliberate spread of messages which are related to nutrition and which have nothing to do with the health, actually, and which have nothing to do with the scientific evidence. So both misinformation and disinformation can really, really impact the health of the individuals, the health of the communities in a very, very negative way, and it can cause some very serious health related issues. So take the example of the simplest thing, which is perhaps the weight loss. So every individual in Pakistan is looking to lose weight in one way or the other. So sometimes patients come to us who have tried all the types of diets which are out there and all the recommendations which are given by the nutritional quacks, and then they have sometimes irreversible impact, which can have very, very serious or life-threatening implications as well. So we cannot take it in a very light way. And as you very rightly pointed out, that nutritional quackery is very, very underrated in Pakistan. So since any healthcare provider is dealing with the life of an individual, with the health of an individual, so here the margin of error is absolutely minimal. So we cannot take any chances when it comes to the health of the people or the life of the individuals. I absolutely agree. So see the socio-cultural factors basically play a very important role in perpetuating the problem of nutritional quackery. So say for example, when you see the cultural dynamics or the social dynamics here in Pakistan, so one of the very important things is that as a nation, we want results overnight. So whether it is wealth, whether it is fame, whether it is success, everyone is looking to adopt, unfortunately, looking to adopt shortcuts. So there are no shortcuts in life. So everyone knows, as professionals, we know you don't get wealth overnight. You don't get success overnight. So similarly, you don't get results in favor of your health overnight as well. So as a nation, it's a dilemma that we are always looking for shortcuts. Similarly, illiteracy is a big, huge problem in Pakistan. So approximately in a country where where the literacy rate is only about 60%, we can't really expect a lot of people to know what nutritional quackery is. And that also obviously leads to issues such as quackery. And then take another example of physical activity, for example, which is one of the most important dimensions if you want to maintain your health. So as a nation, we are one of the most obese countries in the world. Pakistan is ranked as is ranked among top 10 most obese countries worldwide. So that goes to show that we are not really willing to do physical activity. A lot of people would come to you and ask for a miraculous diet plan which can help them lose weight or which can help them manage their diabetes without moving an inch. So yes, definitely there are quite a few socio-cultural factors which really affect the way the nutritional quackery operates in a country like Pakistan. Well, unfortunately, what I personally believe is that we don't really know how to use social media in a positive way. So if you see now, any person with a good fan following is known to be as so-called social media influencer these days. And what is very unfortunate is the fact that for promotion of certain products, for promotion of certain supplements, these so-called social media influencers, a lot of times they would be seen promoting such products which are not really backed by scientific evidence. And since they have following in millions and thousands and hundreds of people follow them, so the product is marketed in a very effective manner. So social media influencers definitely play a very important role in terms of quackery, and that is generally very negative. Similar is the case with a lot of television actors or sports persons, for example. A lot of times you would see hosts or guests on the morning shows giving advice on how to lose weight while they are not the healthcare providers. So if you come to me and start taking tips regarding acting, so definitely that wouldn't make a lot of sense simply because I'm not a trained actor. So based on my personal knowledge, since I lost weight in a certain way, that does not or should not give me a license to give recommendations to the general public, because that can be really misleading, and that can have very serious side effects. Because a lot of times I have seen while changing channels, people recommending keto diet, for example, or intermittent fasting, for example, to as very effective methods to lose weight, which, by the way, either of these is not backed by robust scientific evidence. So these are not the methods to lose weight when you talk about science of nutrition, when you talk about robust scientific evidence. So that is where social media influencers can actually play a very positive role, while in general, which they don't.